June is Men's Mental Health Awareness Month, and over 6 million men in the U.S. suffer from depression, and men are 4 times more likely to die by suicide than women. We're joined now by Mike Andrick, Sweetser's Senior Director of Adult Crisis and Residential Services. So Mike, thank you so much for joining us to talk about this really important topic. And I understand that there's this sort of gap for men who are struggling, between the gap and the number of men who are struggling and the number who are actually getting treatment and diagnosed with the issues that are hurting them. So what can you tell us about that?
Sure, that'd be accurate, Nora, for sure. I know that for a lot of men, there's a struggle with cultural conditioning that starts kind of early on, and men are taught to kind of man up and view help seeking as being weak. There's certainly stigma associated with accessing services like this, broadly, just more for men. Men get into this emotional suppression sometimes, and I call it stuffing their feelings. That has long-term health effects, like men die 3 years earlier than women, comes out like cardiovascular disease or hypertension. Sometimes it's limited coping skills, and thinking about how men express their feelings, not using I statements. It can be isolation, where folks are just avoidant or emotionally shut down. Lack of healthy outlets, I would say, as well. Might be exercise, could be hobbies, could be therapy. A lack of like a connection to their community where that isolation is happening. Like, I love Cooper Flag. That's definitely a hobby. You can have biological factors that impact things as well, where folks are genetically predisposed to depression or anxiety. So those would be some reasons why you have that gap.
Yeah, and looking at that gap, that helps us identify some of the things that could help too, which is great. And so if you're looking to make sure that the men in your life are okay emotionally and mentally, what are some of the warning signs that people should be looking out for? I
think dysregulated mood, increased irritability, sudden anger, I call it cranky pants, can be symptoms of depression or poor impulse control in general. Escapism, so to speak, where there's more, too much focus on sports or work, not enough focus on themselves, and feeling some of the things they may need to feel. Increased substance misuse certainly can be a factor, and that's almost like shutting the light off and not feeling some of those things. People can have physiological symptoms like headaches or have poor sleep hygiene or experience chronic pain would be some things to kind of look for.
Okay, good. And once people are able to get treatment or support, what does that look like for some men who might have some different needs?
Sure. I mean, in any therapeutic relationship, there's always a focus on being authentic, being real, being genuine. So it's developing that relationship with someone as you're doing that work. Certainly, evidence-based strategies are employed, like cognitive behavioral therapy, which is ultimately, it's if you change how you think, you change how you feel, you change behavior. Or dialectical behavioral treatment, which helps people identify self-soothing strategies, coping skills that work for them, that are grounding. I call it like riding the wave. Like, if you think about the ocean, waves come in, waves go out. Waves come in, waves go out. That's ever constant. Sometimes our feelings and emotions are like that, and I used to like to boogie board with my son at the beach and ride those waves. So in therapy, you're teaching some of that. Like, how do I sit with that? How do I ride that wave that I'm feeling right now? And it could be a really big wave.
Okay, good to hear. And lastly, where should people call if they're looking for resources?
If there's an imminent safety issue present, it's always going to be 911. But otherwise, folks can call or text the 988 number, also our peer support line to access peer support or crisis services. And I think we have that listed on the...
Great, yeah, right on the screen. You can take that down, and the 988 number is always a good one to remember too. And I am bad at memorizing numbers, and that one I've got down pat, so that's a good one to keep in mind. Okay, well, Mike, thank you so much for joining us to talk about this really important topic. I appreciate it. Thanks.
Thank you, Nora.